Hello, everyone. This is Miss Nikki, your teacher for nurse aid class. Today, I want to do a recap of what you should be doing or how to maneuver through our website. And we're going to talk about the test, the state exam test, and what they expect. And then we'll go through the first module that you should have already went through. So I'm going to start to share my screen. Okay, so I'm hoping you can see my screen right now. I'm going to go to home first on the internet on our website. Okay, and again, just to recap, you should be. This is our website. To get to the course, you can either go to My Courses or you can go to Our Courses. Either way, but your course in progress would be over here. So even when you take a test, let me just show you that real quick. It will show your progress. So your grade sheet is already on here. I have to make these pictures smaller. So your grades would be right here. And also kind of tells you who's online. Okay. Now let's go to the CNA. Course. Here it says, this is your first page, and you had to put in your code to get here. You also have to be signed in. So either your picture is here, and I hope everybody puts their picture up because I'm wanting to form a collage of pictures for the website. So here you should have watched the introduction video. Always on page 1, if we give you a list of glossary terms, then you want to, anything in red, or I try to put everything in red that's clickable, okay? So if you see it's in red, then you should be able to click on it. The schedule updates constantly every month, so just make sure that's the right schedule for you. And then Cna lessons are right here. And then we get to the end. So the first lesson is Cna Lesson 101. I'm clicking on that. And it asks you to do some things. Look at your skills Bible. Okay, what is your skills Bible? Well, I'm gonna have to leave off of here. And what I'll probably do is put a link here. That would be pretty smart. Come over here to Cna textbooks. And you see the Cna Bible Prometric. So this is, oh, it's a Pantheon site. Didn't know that. This is it right here. As a matter of fact, I need to put that in red. So let me just do that right now. Anything. So what I did was I titled it Cna Bible and I've made it red. Okay, so when you go to it, let me go ahead and update before I forget. And here is the link. And so it won't confuse you as well. I'm gonna take that block quote out. Okay. And then, let's see. Welcome to Health and Human Service Commission. Anyway, we're talking about how we're contracted with Prometric. Prometric is a company that administers the nurse aid test. So when you're done with everything, they will, with this class, you will have to take a state mandated test to be certified. Also, when you come to the test, you definitely have to put on your mask and wash your hands, so you know all that, of course, with everything going on. This is just talking about how Prometric actually took over in September. So they're new to us as well. Very new provider for us. All right. For the latest CDC information about COVID, you can click on there. Preparing for the exam. Okay, so to prepare for the exam, here's a checklist of things, the skill instructions, all the things that you will learn in class and I will have questions on. And sometimes your test will say, refer to the skills checklist or indirect care behaviors, which we're gonna look at here in a minute. I love cnaplus.com. I'm sorry, cna.plus, it's not .com. They have practice tests and I like to do that when I'm on a Zoom or in the class with you. We will definitely pull that up and complete. This one I'm going to take out only because this is from our old vendor and it's about COVID and testing. So I'll put a new one up for, well, I've already put the other one up. So just take that out. All right, let's go ahead and update that. And of course, it looks different for you. Let me see if I can view the page so you can see what it looks like now. Okay, so I went to CNA textbooks. Here's your skills Bible, so let's click on it. Hope you guys are doing good. Proud of you guys for coming. All right, so we have a clinical skills test checklist. I'm gonna go ahead and read this out loud because there might be some questions and I can give you some answers. Okay, so here we go. It says during training, you learn many skills that are important in caring for residents. There are 22 skills. You guys write that down. There are 22 skills. By the way, whenever I have a Zoom attached, make sure you bring your notepad and your pen and what have you, so you can write some notes down. So we have to learn 22 skills, all right? So that are a part of the clinical skills test. When you are registered to test, a computer will decide which skills will be on your test. So the examiner that comes out, that's hired by the state through a service, they cannot, they don't designate what skills you get. It's already, spun through a computer and shot out, and that's what you get. And she can't change them either. A clinical skills test consists of 5 scored skills. You guys remember that because that's going to be a test question for you. So far 22 skills. And then the clinical side. Now, clinical means hands-on. Okay, that's your practical. All candidates taking the test are scored on hand washing and indirect skill. Another test question. Hand washing. So every single one of you guys will have hand washing and indirect care skills. What does that mean? We'll get into that, but just to let you know, it's things like how you take care of them, your demeanor, how you speak to them, safety, privacy, the way you would care for a patient outside of just the hands-on. How do you care for that patient so they're safe and they're more independent and you give them their rights? So they're going to be looking for that. When you take the test, when you take your test, you will be given instructions for the other skills that are part of your test. So if you think about it, if you got hand washing and you got indirect care skills and you got a total of 5 skills, that means there are 3 other skills that we don't know that you will have, right? Okay. Because you may have to learn to perform skills in different ways for different residents' needs, you are given instructions that describe how the skill is going to be tested. For example, if you test on the feeding skill, you will feed a resident positioned in a chair. So not in a bed, in a chair. Remember, you are still responsible for knowing how to feed the resident who are positioned in other ways. So if they're laying flat, can you feed a person? Absolutely not. They have to sit all the way up, 85 to 95 degrees, whatever, something tolerable. 75 is the lowest. And they have to sit in that position even thereafter for up to an hour to make sure, 30 minutes to an hour to make sure that they don't aspirate. You say, well, what is aspirate or regurgitate their food? Where food comes back up through the esophagus and it actually goes down the lungs. That is called drowning. And we don't want that. And they could suffocate. And we don't have that much space in there where we breathe. So if anything gets blocked in there, then we also suffocate, we choke. And of course, that can lead to death and brain damage if we survive. Okay, the knowledge, which they call it the knowledge test. I like that. Love the knowledge test. Also called the written test. May also ask you questions about feeding residents in other positions. So we're going to talk about, in class, you'll learn about the supine. Supine means laying on your spine flat. Do you lay them in the prone position, which they're laying on their face? Absolutely not. They need to be in what's called a Fowler's position. Fowler's position is sitting up. If you're sitting in a chair right now, you are sitting in a Fowler's position. And there are different degrees to Fowler's, but if you're laying flat, you're laying flat. You're not in a Fowler's. As soon as you raise the head of the bed up, I don't care what degree, you are in a Fowler's position. So we want people in a high Fowler's position for feeding. Okay, next. Each skill in the test has checkpoints. The evaluator nurse, which is a nurse, and she's an RN, giving your test, will use these checkpoints to rate your performance. After you complete your test, the evaluator will enter his or her observations into the computer. So all this is computerized. It's so awesome. Whereas before, everything was paper and kind of the old fax machine way. So this is all computerized. Prometric system will then determine your results. Your results will be provided to you on the day of testing. So awesome. Unless a technology issue, such as a printer problem at the test site prevents the evaluator from providing your results. If you are not provided a score, report on the day of testing. See the candidate bulletin, which I'll show you where that's at, for information on accessing your results online. So even if say the printer messed up, it's still in the system. So you could just go online and find out if you passed. Beautiful. The checkpoints for each skill are listed on the pages that follow. So we're going to look at these checkpoints. It is important that you understand that the checkpoints are not written as procedures. These checkpoints are not provided to help you learn the skills, but to help you understand what the evaluator will look for when you're performing the skills. So to say, you don't just have to do the checkpoints. We want you to be natural and flow. We don't want you to be a robot. Okay, checkpoint 1, checkpoint 2, and not go out of your, safety zone. And I want you to just feel like you're really taking care of that patient effectively and passionately, emotionally, that Because if you really care about that patient, you will not forget the call light. There's no way you're going to forget that that's their communication to the world. And they really need help. You're not going to forget to cover them up when they're cold before you leave, or leave the bed this high when you walk out the door and they can fall down very high. You're going to bring that bed down. You're going to make sure it's locked. You're going to make sure, ask them if they need their door open or closed. Do you want your curtains open and closed? Here's your call light. Bring their bedside table over to them. Maybe they have a cell phone. Maybe they like their makeup by them. Maybe they like a deck of cards. Whatever it is, you're going to make sure that they're comfortable before you leave, while you're there, and answer their call lights. And that is what they're looking for. They're looking for that passion, that thing in your heart that made you say, I want to become this. And you can't fail that. If you fail that, then you fail being a nursing. You cannot fail your heart. It's kind of impossible if it's there. Now, you can get nervous. That's a whole nother thing. So we're going to talk about nerves later on. All right, the procedures for the skills are learned from your instructor, nurse aid textbooks, and other training materials. So again, I give you the guide, I give you the instructions, you own it, you take it home. The procedure for any skill may include more detail about important requirements than are shown in the checkpoints. Your performance may include more detail than is in the checkpoints. So they said it right there, give them some detail. They pay attention to detail. Just like now, that checkpoint is not going to tell you about swallowing disorders and things like that. It's going to tell you, hey, this person's sitting in a chair. But there's more to it. Why is that person sitting in a chair? And as I just told you, we want to prevent aspiration. Any food or fluid or anything other than air going into the lungs. You do not want to swallow a piece of broccoli and it's in your lung. Not cool. And then you're going to have to go to the hospital because your lungs can collapse. And you'll have a hard time breathing, and you can get pneumonia, just a plethora of other things. And you don't want to be that reason that somebody doesn't come back from the nursing home because you didn't have the patience to feed them right, or you did not get the right diet. All right. A description of instructions given to the candidates for each skill is provided below, along with the checkpoints for each skill. The description includes if a person or a mannequin is used for the resident. The description is so important to read. A lot of people will skip the paragraph above the skill, and when there's so much information in there. And I like to read from top to bottom, everything. So the title, the mini title, the small synopsis, whatever it is, because it's like you missed something and you wouldn't know if the skill is performed on a resident or a mannequin. And that's very important. Usually another candidate will play the role of the resident when a person is used. In special situation, the evaluator may need to play the resident. Wouldn't that be cool? Not scared at all. Maybe. When you are waiting to take the test, you will be given general instructions to read. These are basic rules for the clinical skills test. For example, these instructions explain what you need to do when you want to make a correction to a skill you are performing. These general instructions are made available on the website here, which we'll go to. You can see all the links and things that you need are here. And also, and this link is really the one you need because it has all the other links on there. Okay, the testing room will be set up. You are encouraged to review them before you arrive to your test site. Okay, when you are called into the testing room to take your test, you will be shown around the testing room so you can see where equipment and supplies are located. And yes, even if you went to this school, it doesn't matter. That is her job to make sure that you are comfortable with the setup. and you are knowledgeable about the setup. The testing room will be set up similar to a resident's room. For example, personal care supplies such as resident's toothbrush. I might ask you this question. Resident's toothbrush, toothpaste, basins, and bedpan will be at the resident's bedside cabinet. So there's a little bedside table that we have, like a nightstand, that these things will be placed there. And that makes sense. It's their stuff. They technically, a lot of them don't have their own bathroom, and they want their personal items there. So if somebody else goes in that bathroom and maybe it's a community or a 2-room bathroom and it connects to another 2 rooms, you really want your toothbrush and toothpaste all in that area. Somebody might, can't find mine, let me go ahead and brush my teeth. So you kind of want your personal care items next to you. When you're taking the clinical skills test, remember that you are required to actually perform the skill. You can't just quote verbatim the checklist points and stand there like you're in a spelling bee. That's not going to work. The evaluator is not allowed to answer any questions about how the skills are performed. So really, if you have any questions, you definitely need to ask prior to anything starting. I'm sure she'll be happy to answer what she can. Okay, let's look at the first skill and the description prior to it, hand washing. When taking the test, candidates are given instructions about when to wash their hands. This is because nurse aides are expected to know that their hands should be washed before any physical contact with a resident. I don't know, but I've been in doctor's offices where I've seen them go in my room, come out, and jump in the next room. And I didn't see any hand washing. I usually say something about that. Tap, tap. Because as healthcare professionals, we're the ones kind of carrying this stuff around, right? Like I see people in the stores, and they still have their headgear on and, maybe their lab jacket and their shoes and their booties and all that. I'm like, did you just come out of a COVID room? It would be nice to keep, have a set of clothes or something to put over your clothes when you go to lunch or you got to go in the grocery store, because we could be spreading the germs. Healthcare professionals, wash your hands. So important. Candidates are evaluated on how well they wash their hands, which we call technique, during the first skill. So that just told me my very first skill is hand washing. In Florida, where 2 nurses will be observing your performance throughout the test. One nurse will observe your hand washing at the beginning and of the skill first, and the other will observe hand washing at the end of the skill. We're in Texas, so you'll just have one evaluator. After the first skill is completed, for the remainder, another important, for the remainder of the test, hand washing is evaluated as a part of indirect care with the checkpoint. Use standard precautions and infection control measures when providing care. Hand washing is one of the 5 skills scored in every clinical skills test. So they're saying right there, everyone has to do the hand washing, and it's first. Okay, going back to use standard precautions. What is that? And infection control measures. Standard, think about that. Standardly, there's always a standard, something you do minimally. And then precautions, which is before, and then caution, caution. So before it happens, what is the standard before something bad happens? That's pretty much what it says, right? I better wash my hands. If I'm going to come in contact, this cup was full of urine. Am I going to touch this cup with my bare hands? Absolutely not. I'm going to wash my hands and put gloves on. And after I take my gloves off, I'm going to wash my hands. Basic common knowledge. Now, there are steps above your basic standard, which is called, when you need your PPE. So transmission-based precautions, sorry. lost my train of thought. So transmission-based precautions, which they used to call universal precautions, but or isolation precautions, sorry, meaning that that person is in isolation for a reason, not just because they urinated in a cup. No, it's because this urine in the cup, which this is not really urine, but it's nasty. It's got MRSA, methicillin-resistant Staphylococcus aureus, or Klebsiella pneumoniae, or something, E. coli, whatever the case may be. So you definitely want to make sure that you're washing your hands, just using standard precaution and wearing your gloves when you're going to come in contact with blood or bodily fluids. And if it is urine, guess what? We need to step above and it's splashing. We need a face guard. And when you have transmission-based precautions like TB, tuberculosis, which is a lung bacterial infection, can come out in droplets and what have you, you need an N95. Look at COVID right now. COVID right now, what do you need? You need a mask, period. A mask, cloth mask, N95 mask, a mask. It's real, and we definitely need to protect ourselves. And it's not really, it's not funny at all, but it's kind of sad to see that people don't want to wear the mask. It's important. I think that we could definitely get things back rolling if everybody was responsible, and you are number one responsible in healthcare. There's no way you can deny science. You're in healthcare. All right, let's look at this skill, hand washing. Does the candidate, one, so what do you mean does the candidate? They're asking the nurse, your examiner, does this person do this? Does the candidate, one, begin with wetting their hands and applying soap? Or did you apply the soap, then wet your hands? Guess what? Out of there. Can't get number one. Did you use friction and distribute the soap and create lather, cleansing from front to back of hands, between fingers, around cuticles, under nails, and wrists? Did you get all these? Might be a test question I might ask you. Did you provide cleansing and friction for at the least? They didn't say under 20. You can go above 20. I suggest you go about 25, because sometimes you get a little nervous and you're doing everything, and you might go 18. And if you just do 18 seconds, that's out of there. Did you rinse your hands, wrists, removing soap? They're going to be looking. If you go too far up the wrist on your forearm, you got soap up here. Guess what? You won't get that either if you don't get that off. Did you rinse your hands and wrists, removing soap? Sorry. Did you use a clean paper towel or towels? You can get as many as you want. Don't get that many. I'm just kidding. To dry hands and wrists and dispose in the used paper towel in the trash. Saying that, let's say you dried your hands with a clean paper towel, but you left it right on the counter. Man, can't get that one either. Can't get that checkpoint. Did you end the hand washing with clean hands, avoiding recontaminating hands before the recontamination of hands before procedure completed? Meaning, did you touch the sink? Look, you're not supposed to be touching in the sink, the faucet, anywhere, hand, the knobs, anything with your bare hands. For example, having direct contact with the faucet handles. Okay, there you go. Once your hands are washed. No, you're going to get a paper towel for that. All right, so they didn't really tell you how to do that. And that's where I come in. It's where I come in and train you on how to turn off the water, how to turn on the water and all that good stuff. All right, I'm not going to read all these to you, but now you know that you need to, well, let me read one more. Hand washing, you know you're going to have hand washing, right? You know you're going to have indirect care. Let's read indirect care. Indirect care is a skill that is evaluated while you perform each skill. The skill evaluates behaviors that are common to any resident care such as infection control, safety, communication, residents' preferences, needs, comfort, and rights. Like I was saying earlier, how you would really care for that patient and how you want to be cared for if you were that patient. You're not given instructions to perform indirect skills, care skills. It should be natural, given. The evaluator watches for these skills. Can you see me? The evaluator watches for these behaviors while you perform each skill. And the checkpoints provided for each skill below, indirect care checkpoints are identified as IC. Like over here, you see IC? It means they're looking at indirect care with that. Look at there, 16, ask residents about preferences during care. Here we're ambulating a resident, meaning we're walking them. Ambulate means to walk. So we're asking them. Maybe we're asking them things like, okay, are you ready? How do you feel? You know, you ready to put one foot in front of the other? Do you feel the back of the hips against it? Do you feel your back of your hips against a chair? Are you comfortable? Would you like your call light? Would you? Well, we know that. Would you like your bedside table next to you? Would you like your door open? You know, things like that. You want to make a phone call? Talk to your mom? Maybe not mom. Well, could be. You work in a hospital, work in pediatrics. Okay, so let's look at some of these indirect care skills. Does the candidate, 1, greet resident, address by name, and introduce self? This is something I want you guys to do on video. I want you to do this. I want you to record yourself, and I want you to send to me. This is what I want. You can make a whole, now I'm just giving you a checkpoint, but you can make a whole Hollywood movie on this. I don't care. And if it's too big to send, then there's this link called sendthisfile.com, sendthisfile.com. And I'll put the link on the site so you'll have it. But I want you to do this. Come in the room. Maybe you open and close the door. Or before you open the door. And you come into the room. Hello. How are you? My name is Nikki and I'm your student nurse aide today. Can I get your name? First name and last name? Now, that's if you're in a hospital. If you're in a nursing home, it goes different. Hello. Hi, my name is Nikki. I'm your student nurse aide today, and I'm here to give you a bed bath. Number 3. Hello. How you doing, Mrs. Smith? Address the client by name. Tell them who you are. Are you the President of the United States? No, I am the nurse aide. Hello, how you doing, Mrs. Smith? My name is Nikki. I'm your student nurse aide for today. I'm here to give you a bed bath. Is that going to be okay? Oh yeah, sure. All right, so let me go get my supplies and I'm going to go wash my hands and I'll be right back. All right? Great. That's all I want, you guys. I want you to knock, greet the patient, tell them your name, explain what you're going to do, and I'm good with that. Okay? Make it your own. Make it beautiful. All right, next. Provide explanations to the resident about care before beginning and during care. So, what are you doing? I'm going to go back in and I'm going to give that bed bath. Okay, so what I'm going to do is take your gown off and I'm going to put a bed, another sheet, clean sheet over you right now so you stay warm. And then what I'm going to do is I'm going to go get some water, make sure that it's warm, and I'm going to feel it. I need you to feel it. You know, just things. Just talk through the process. Ask the resident. Let's see. Use standard precautions. Okay. Remember, before I even touch that patient, I had to wash my hands. Now, remember, you washed your hands in the sink, and you showed them for real. Now, and this is based on the nurse as well, you should be able to just rub your hands together, although with COVID guidelines changing all the time, they may ask you to use hand sanitizer. Okay, so just follow their instructions. That's nothing written here. That's just ever changing rules and regulations. But however, before you do anything, before you touch that patient, when you start every time, I need you to throw your hands around. Okay, well, let me just, it's just very natural. After you do this for so long, it's just natural. It's natural to lock the wheels and pull the curtain. I got this dance called the Nikki dance. Lock, pull. Love it. Okay, so anyway. Next, oh yeah, don't forget standard precautions. You know what that is, right? Ask the resident for comfort and there's one thing that people say, and that's fine. You can use it for the test. Are you okay? Are you okay? You don't want to say that too many times. You're like, I told you I'm okay already. Okay. So in real life, but for test purposes, that's fine. Say things like, does that feel comfortable? Would you like me to bend your foot this way? Or would you like your pillow up under your arm this way? And then after that, you can just say, and then you can say, great, does that feel okay? But say something with it. Promote residents' rights during care. They have a right. Remember I asked that lady, was it okay if I can give her a bed bath? She can refuse. If there's a test question that says, Mrs. Smith does not want to take a bath, do you ask her why, or do you respect her decision? First and foremost, you're going to respect the decision. You can ask why afterwards. You're going to say, I see. Well, is there a better time I can come back and do that? Because you respected that she didn't want one now, but can you come back, right? And I just need to let the nurse know, okay, thank you very much. And you can ask, is there a reason why you don't want to take one now? Oh, every time I go in there, water's cold, the room is cold. Oh, okay, I understand. I tell you what, why don't I go in there right now and start running the water, turn on the heat lamp, and put a bunch of towels over you. And I promise to make you nice and warm. You can let me know if you don't feel that way. Change up. Maybe somebody has been wheeling them down the hall, with a thin sheet on, no clothes. I wouldn't want to take one either. All right. Last, promote the resident's safety during care. If you turn them over and the side rail is down, they're going to fall off. Side rail's up, bed's in low position, wheels are locked. Do not walk away from a bed and the side rail is down. Do not turn your back on a patient. If it has wheels on it, lock it. Wheelchair, shower chair, I don't care what it is. Doesn't matter. Just wheels on it, lock it. Make sure they're locked every time. You don't know if somebody else came in there after you unlock the wheels and then you go to, 1, 2, 3, push somebody over and you go flying off with her and the bed. So it's not just the patient's going to get hurt. It's going to be your back, your hip, your knee. So, all right. So you should have already, and if you haven't, written your 22 skills down. Only the green titles. Hand washing is 1, indirect care is 2, 3 is ambulation. So you just go through. I don't want you to write all the checkpoints. All I want you to write down is the skill titles. And there will be a question about your skill titles. Okay. All right. I am, see what else do we have here? Take a quick break and then I'm going to come back. We're going to talk about the test.